Hello, I'm Nurse Linda, and welcome to the professional webinar sponsored by the Christopher and Dana Reeve Foundation. It's very nice to have you all with us today. We have an interesting topic about peer mentoring. First, I'd like to describe myself. As I said, I am Nurse Linda, and have very fair skin, brown hair. It's got a little touch of gray in it, well-earned gray. I wear glasses that are skin-colored glasses. I have on, if you look at it one way, it's a green sweater. If you look at it another way, it's a blue sweater. So it's one of those internet anomaly clothing items. And the background behind me is white. I would like to welcome our guests today who are discussing peer mentorship. And we have Dr. Susan Newman, who is a PhD, a registered nurse, a CRRN, and an FAAN, which means she is recognized by the Nursing Academy as one of the top nurses in the United States and perhaps the world, I think. She's the Associate Professor, Assistant Dean of the PhD program in Nursing Science at the Medical University of South Carolina College of Nursing. So welcome, Susan.
Thank
We
you.
also have Brian Denny, who is the outreach coordinator for South Carolina Spinal Cord Injury Association. In 2016, of note, he was South Carolina's Vocational Rehab Client of the Year. So congratulations, a little bit late, Brian, but good
Thank
job.
you.
And we have my dear friend Bill Cawley, who is the director of the mentoring program at the Christopher and Dana Reeve Foundation. So welcome all three of you. Would you like to take a moment to introduce yourselves and just tell us how you got involved in the world of paralysis? And we'll start with you, Susan.
Okay, well, thank you, Linda. So as Linda said, I'm Susan Newman. I am a white woman, mid-50s. I have shoulder length, kind of reddish blonde hair, wearing a jeans jacket and I guess a rust-colored dress. I'm sitting in my office with an unusually clean desk, which I did just for today. So I'm really honored to be asked to share my experiences with peer mentoring with you from a nurse's perspective. Just a little bit of background. I worked for 13 years in an inpatient rehabilitation facility here in South Carolina. It was a general rehab facility. So we had stroke, joint replacements, but we also received patients with spinal cord injury. And over my career, I just really found myself drawn to working with that patient population. Usually they were a little bit younger, extremely challenging patients, terrified about what the future would hold for them. There was so much to teach them. And I just really felt a passion for helping them find that spark within to realize that they could go on and have a productive and meaningful life. It would just be different now with a new injury. At a point in time, I was looking to do something a little different and advance my career. And I knew I didn't want to go into administration or management in the hospital. So I was looking to go back to graduate school, and I found MUSC's PhD in nursing science program. So I went back to school to work on my PhD. And it was during that time that my focus really shifted to the community. You have to identify a research topic when you're working on a PhD. And I was always interested in education of people with spinal cord injury. And at that point in time, my world was the clinical world, the inpatient setting. That's really all I knew. But my mentor was a public health nurse, and she was pushing me to think, she's like, Susan, people with spinal cord injury go home. And that's where they spend most of their lives. So that's when my focus really shifted to the community. And so while I was a PhD student, I learned about a research method called photo voice, which is where you give people cameras and they use photography to tell a story from their perspective. And so I thought this would be a really cool way to learn about how people with spinal cord injury experience the community. And it really opened my eyes because I only knew spinal cord injury in the context of the rehab hospital unit. And so hearing the stories that people told about the photographs they took, there was a lot of altruism that came through in those stories and how they wanted to help other people with spinal cord injury. And so that's where I really said, aha, peer mentoring is really a great strategy to help people transition from the hospital setting when they go home, because there's so much to learn, so much to remember, so many new things you have to find. Having someone who's been down that path already to support you is really critical. And so that's kind of how I ended up in the peer mentoring world.
And I have to say, I've heard you speak about the photography study that you did, which was really fascinatingly interesting. Brian, Tell us a bit about yourself.
Sure. My name's Denny. I'm a white male with dirty blonde hair. I have a beard and just realized how much gray is in it. I'm wearing a blue plaid shirt and I am in a wheelchair. And actually Friday will be my 14-year anniversary, as I like to call it, from sustaining my spinal cord injury. And I am a C3, C4 incomplete. So I'm paralyzed from the shoulders down. I went back to work in 2016, as Nurse Linda described that, and I began just getting back out in the community because going from being completely able-bodied to only being able to use my shoulder or my neck and my mouth to function, I went through and used the services of folk rehab to go back to work. And I apologize, I have my earbuds in, so I'm trying to speak as loud as I can. Sometimes they don't work right, sometimes they do. So I'll try to speak up.
Okay, well, we're hearing you just great, Brian, so that's good.
Okay.
And Bill Cawley, tell us about yourself, my colleague from the Reeve Foundation.
Yes, absolutely. Thank you so much. I'm really glad to be here. And thank you for the invitation. I'm a white male with graying hair, but I'll just it's thick, so I'll take it. I am a wheelchair user. I'm a C6, C7 quad. I'm sitting in my office. I'm wearing a gray sort of 3/4 zip sweater. And so, as I mentioned, I was paralyzed. I got paralyzed. I was in a diving accident back in 1992. And prior to joining the foundation, I spent a bulk of my career in financial services and the credit card industry and doing those kind of things. And then I had the opportunity to join the Reeve Foundation back in 2009. Had a little bit of a prior existing relationship with them because I had done some fundraising and things before, after my injury and up until I actually joined the foundation. And so had an opportunity to come on board with Reeve. And shortly after joining the foundation, after doing some chapter development type work and those kind of things, we had the opportunity through a grant to start a peer mentoring program, which we started really in earnest in 2011 and stuff. So I've been directing that program ever since, as well as doing other things like support groups and other work within the foundation and stuff. So, but I'm really, it's a pleasure to be here. Appreciate it. And big fan of the group here. So thanks for having me here.
All three of you are here, and I know that you have done work together on a project. And so who would like to describe that mentoring project?
Well, it's kind of been a iterative process. So when I was in the PhD program, historically research has come from the scientists saying, here's what the literature says the problem is. The scientist figures out how to fix it. But the problem with that is a lot of time there's a mismatch between what the scientist thinks the solution to the problem is and maybe what the patient or the population thinks the solution to the problem is. So there's been growing initiative over the past 20 years to have community engagement in research, and community can be defined in many ways. But for my work, the community has been people with spinal cord injury. And it's great to see now many of the federal funding agencies are requiring, whether it's a consumer expert, a lived experience expert, or somebody on these research teams, and they're even helping review grants. So from the get-go, I have collaborated with the Center for Independent Living here in Charleston, collaborated with the South Carolina Spinal Cord Injury Association, and then on our most current grant, we've expanded to work with Bill at the Reeve Foundation, folks at United Spinal, another nonprofit in Connecticut called More Than Walking, working together to study what people really want out of peer mentoring. Backing up a little bit, the first really big project that we did together with the Spinal Cord Injury Association was developing what we called a peer navigator intervention. And so we wanted to do a study that looked at how peer support could support people in better outcomes with what's called community participation. This is kind of the ultimate goal of rehabilitation, to help people get back to engaging in life in ways that are meaningful to them. And also, as a nurse, we know you have to be healthy to be able to do that. So we also thought it was very important to support people in preventing secondary conditions such as pressure injuries, urinary tract infections, and appropriate bowel management. So looking at all these things, we put together an intervention which ultimately became known as Phoenix, which stands for Peer Supported Health Outreach, Education, and Information Exchange. Every project needs a sexy acronym, so that's what we came up with. But we also like the image of the phoenix rising from the flames, thinking about recovery after injury. So initially, we started doing this in people's homes. So Phoenix, at that point in time, was a 12-week intervention with weekly educational sessions with a peer navigator who, I think an important thing to talk about with peer mentoring is that there's a lot of training that needs to happen. You don't just send people out, with no training at all to be peer mentors. So we had hired and trained peer navigators who were paid members of the research team that delivered this Phoenix intervention. So they had a curriculum that they would follow with our participants and do education on secondary condition prevention, how to access community resources, and self-advocacy. So as I said, initially we were going out to people's homes, which was great because you learn a lot when you see someone in their home environment, but that really limited the number of people that we could engage in our program. So the next grant was to adapt it for telehealth and online delivery. So then we had a grant funded by the National Institute of Disability, Independent Living and Rehabilitation Research, where we delivered Phoenix online. And during that, we had 4 paid peer navigators who were paid members of the research team through MUSC. It was expanded to a 16-week intervention. So they met with folks weekly for the first 8 weeks and then bi-weekly. And then we did assessments on our study participants at the beginning and end. How are they feeling about their community participation? How were pressure injuries, bladder complications, bowel management difficulties? How confident did they feel that they could do these things at the beginning? And we measured those at the end also. And we did see some improvements in people's feelings about being able to get out and participate in the community as they wanted. We saw improvements in feelings of self-efficacy or self-confidence, that they could do the things that they needed to do to take care of themselves. And we also saw decreases in their perceptions of problems from pressure injuries and bladder complications and bowel management difficulties. So that was really encouraging. We talk about evidence-based advocacy. So having the evidence to support anything you want to advocate for. It was great to hear the conversation earlier that Medicaid's starting to reimburse peer mentoring services. And so generally when you're looking to reimburse some kind of service, you need evidence to show that it's effective. So those were kind of the projects that led to where we are now. So Brian can speak to some of this as well, but we learned a lot about just the processes of what it's like for peer mentoring. How do you match people? So what are the best characteristics to put a mentor with a mentee? For Phoenix, what we did, we primarily used level of injury, and then we looked at the participant's sex and age as much as possible. So we had 2 women and 2 men who were peer navigators. So we had more men participants than women. So some, women were mentoring men, but level of injury was our primary, but we didn't really know what the best was. Matching characteristics. So the project we're doing now, got kind of a couple points I want to make. The project we're doing now is a survey of people who have served as peer mentors, who have received peer mentoring, or who have been in neither role, to find out what they really want out of spinal cord injury peer support. So what are the primary topics that they want to learn about? So we talked about secondary conditions and community participation, but there are myriad other things like parenting. Sexuality was a thing that came up that a lot of people want information on. Going back to work, aging with the spinal cord injury. So trying to help prioritize what kind of educational content we want to build going forward. Again, back to the matching characteristics, asking people what their preferences are when matching with a peer mentor. And just looking at some very preliminary data, I'm seeing that personality and communication style are coming out as something that people appreciate. And in some of our conversations as we went through Phoenix, we got the feeling that maybe it was more there is a personality element that really helps make a good mentor-mentee match, maybe even over level of injury. Similar lifestyle, similar interests could be very important when you're matching someone. We're also asking people about how they prefer to receive peer mentoring. Is it in person? Is it online? How frequent? And those kind of things to help us develop evidence-based peer support programs going forward that really meet people's needs. So I know that was a lot of information there. It's been, 16 years of work. So just kind of trying to put it in a nutshell there.
Well, that was a pretty good job for that amount of time, and that was a lot of work. I know you guys have done a lot. Let me ask Brian what your role was in helping along with this study and information and being a peer mentor. How did you participate in this whole project?
With the Phoenix project, I was the mentor coordinator. So I was kind of I would act as the mentor's debrief person. So if there were issues that came up with the mentee, that's where I would come in and just be a support for them, try to tackle issues as they came up. And we ran across, I think we had 2 participants, Susan, where the personality
Mhm.
didn't mesh, and we had to change up to a different mentor to make it work. And so that's primarily what I did throughout the whole project. And I wanted to add something to with Susan describing the 16-week program. One of the findings we got out of that was that a lot of the participants felt it was too rigid
Mhm.
because they didn't want to meet. Well, they met every week for 8 weeks, and there were specific goals discussed. Sometimes they weren't done. Sometimes it was too soon or too fast for the mentee. They felt like they couldn't accomplish what they wanted to.
Mhm.
So that's now that we're on to the next phase of the research project. We're easing that rigidity and making it a little more informal.
Yeah. And
if
that's a
that
great,
helps.
yeah, that's a great point. So balancing, comparing apples to apples with a research project, you want everybody to get the same thing, but that really doesn't work well with peer support, which is such an organic process. So we did have the rigid schedule of meetings, which, as Brian said, didn't work for everybody. We had the set educational content that the peer navigators were supposed to talk about each week, but people had questions about sexuality, like I mentioned, or maybe wanted to talk about other things. So Brian's absolutely right. What we've talked about going forward, that we need to build some flexibility into a program like this, where people can, the mentor and mentee, agree how often they want to meet and when they want to meet, and can agree on the topics they want to talk about, and that we could create a resource library of information that they could refer back to. One thing that we did for this project that was really fun, we created some educational videos where we wrote the scripts. Brian and my colleagues were the actors in them. They're kind of grassroots, but they're different. When we were looking for educational videos online at the beginning of this, when we started this program, they were pretty dry. A nurse with a PowerPoint, ho-hum, put you to sleep. So we tried to integrate some humor into them, talking about bowel management and preventing pressure injuries. So I provided a link, yes, which was just posted in the chat. So we've posted these on Vimeo. So if you want to take a look at them, feel free. The information in them comes from the Model Systems Knowledge Translation Center on these different topics. So it is good evidence-based information, but we work together hearing from the community to present this information in a little bit more engaging way. So hopefully people might remember it, maybe actually enjoy hearing it.
Yeah, just
And
go
I
in with
know
the
Bill,
understanding. Just go in with the understanding that we're not professional actors.
But it makes it more fun. I mean, this really is a grassroots effort. It really is.
They
I
were
think
fun
that
doing.
makes it, I think that makes it a lot more real, Brian. I
Well,
think you know
exactly.
exactly what you're talking
Yeah, that's
about.
true.
You're
Exactly.
not playing the part, you're living the part.
Right.
And I know Bill was involved in this project as well, but Bill, could you talk about your role on the project and also about the mentorship program at the Reeve Foundation?
Yeah, thank you. Yeah, it was it's been a great project, great exercise. We're sort of, I guess, still in process in a lot of ways with aspects of it, but I was happy to join as someone who's been managing a program now for 10 plus years. I think I was just there to try and provide some perspective on what we've seen, what we've done. And it's funny because some of the same challenges that, Susan just outlaid, we talked about how often should they meet? Who drives the agenda? And we kind of started out with what we call a peer focused program. A peer in our vernacular is someone who's receiving the mentoring and stuff. So we really made it a peer centered program from the beginning, which was letting them dictate how often they want to talk, what they want to talk about and stuff. But we've gotten feedback sometimes that they'd rather actually let the mentor direct it a little bit more because they're so new to it or in a bad spot. So Susan, I think you've referenced a little bit sort of indirectly and directly. It sort of depends where they are and what they're working on, what they got going on in their lives. And it's different for everybody, different based on the support you have, where you live, and all those kind of things. So it's been a great exercise to go through, to listen to people from different perspectives, the clinical professional side, the Brian, like myself, people living it, and kind of figuring out, again, there's no perfect mentor philosophy, if you will, but building one that has the fundamentals that will allow someone to move on and keep going and but still have that flexibility to allow them to get what they need when they need it in a lot of ways.
Yep.
And stuff. So it's been fun being part of, as we're looking at looking at from the, what does a peer want from the mentor, and really diving and digging into that, which we continue to do, which is a great perspective to look at it that way.
And I would imagine not all peers and mentors hit it off. I imagine sometimes you need to change, and that's a possibility that you can always change. So, don't think, oh, I got assigned to this person and, it's really not working, but this is what I have. Always know that you have options.
Yep.
Yeah, I'll
And
speak to that just from our program for a moment, if you don't mind. What we do is after we match someone, we do some follow-up to kind of say, hey, how's it going? What's going on? We have a couple checkpoints or touch points after they've been matched. And very clearly in our email communications, when we do that, we make clear, listen, this might not be a great fit, and if you have questions or need something else or something's changed, let us know. And we're happy to rematch you basically and stuff. So we spend, a fair amount of time doing that. And that's okay. And that's a good thing. That's absolutely a good thing.
Yeah, and as Brian alluded to, that happened a couple of times during the Phoenix research study, that there was just obviously not a meeting of minds with the mentor and the peer. So we did reassign them. One thing we've done differently now, so the Spinal Cord Injury Association is implementing kind of a modified version of Phoenix with a lot more flexibility. So what we did, we created video biographies of our peer mentors and posted those on the website. So people who are interested in being mentored, and I know Reeve Foundation has kind of profiles of their mentors as well. So people can pick who they think they might want to work with knowing that, when they actually start working together, it may not work out, but the peer mentors know that they could potentially refer that person to another mentor if they feel like someone they know might be a better match or has more expertise in an area. If it comes up that the mentee has questions about something that particular peer mentor doesn't feel comfortable talking about. So again, giving the person who is being mentored, the mentee or peer, a little more control over that process and the matching, and also the topics that they talk about, I think has been important. It was interesting, a conversation we had at the end of Phoenix, that a lot of the peer mentors felt like being in the role of the peer navigator created this kind of false hierarchy where the expectation was they were up here as the mentor and the mentee was down here, and they didn't like that. That was a really uncomfortable position to be in. And so it felt like, being in this paid position with the research study kind of created this artificial role for the mentor that they weren't really comfortable with. And so that was a great point to learn. And so it makes us think about how we can employ, our mentors. I think the work they do is valuable and should be compensated as much as possible. A lot of people do mentoring in a volunteer role, which I appreciate that, and sometimes that's, a lot of these nonprofits don't have the funds to pay peer mentors, but I do think, valuing what they do is really, really important.
Absolutely. And that certainly brings up an interesting point of that hierarchy in relationships, which
Mhm.
sometimes people do take advantage of that even without consciously thinking about it. But the whole idea is that you learn from each other.
Mhm.
So oftentimes the new person maybe has had experiences that the person who's been injured for a while hasn't had exposure to new research or new things, and so you can work in tandem together, and you shouldn't feel like you're ever in a subservient position or that this person has all the answers, because nobody has all the answers. Nobody. I wish somebody did. It would be great if we had all the answers, but we're learning as we go. So, if you were out in the community and there is a question in the chat, in the question and answer about how do we learn more about the Phoenix Project, and your video link has been posted there in the chat box. So be sure and check in there and you'll see the link for that. Then there's somebody who was looking for what funding sources are good to look for to apply for funding for peer-to-peer program training. Does anybody know of any funding out there for that?
I know of it from a research perspective, but that's probably not what you're looking for. I know, I don't want to misspeak, but I know Reeve has the quality of life grants. I don't know if they would support something like this. The Craig Nielsen Foundation has money to support organizations. We've gotten funding from Nielsen, I think, to do an adaptive sports program. So, peer support is really valued in the spinal cord injury community. I can't imagine someone having an injury and not receiving peer support. I mean, I'm a nurse. I can teach you the nuts and bolts of how to take care of yourself, but I could never do it in a way as someone who lives it every day. So I think having that perspective is really important. So I know it's valued. So those are the two, that immediately jump to my mind. I think the PVA has funding, Paralyzed Veterans Association, for education initiatives, which peer support could certainly fall under.
I'll just jump in for a second. It's Bill. So yes, you're right. The Quality of Life Grants Program through the Reeve Foundation is a program that does fund mentoring programs. There's an application process and a review process that goes along with that. But mentoring programs and of those ilk have been funded. So that's an opportunity to take a look at. The PVA is doing it. We're actually working pretty closely with the PVA. And we've done some trainings for their folks at some of their chapters. So the PVA is getting more and more into mentoring as well. But I don't know if someone can, my hands aren't that great in terms of being able to drop something in, but if we could drop something in about the Quality of Life Grants Program, that would be great. And take a look. Like I said, there's a review process, an application process, but there's a lot of online support that will allow you to figure out how to apply. And it's actually not too difficult.
So that will help you set up and did you?
Oh, yes, there are also grant search engines that you can look up grants for a host of different things. There's grants.gov to search for government specific grants, and you can also always contact your state Department of Health or area agency on aging and disability for additional grant opportunities or funding resources local to you.
And independent living centers might have some information as well, as I'm just thinking out loud here.
They do a lot of peer support.
Yeah.
So
So
collaborating with somebody.
ACL, Administration on Community Living, does fund a number of programs, but you should be able to browse for those at grants.gov if it's a grant specific thing you're looking for.
I think an important thing to think about too is that you don't need to reinvent the wheel. Find someone to collaborate with, that may already have a program going similar to what you're interested in, and you could potentially adapt it for spinal cord injury if it's not specifically for that population. But I think talking to a center for independent living, if you have one in your area, because peer support is a part of their mission as well, finding someone to collaborate with, I think would be really helpful. For Phoenix, we have a training manual, which I'm happy to share. I mean, it's limited to the content that we used in our last project. What I'm hoping to do is update that, based on what we learned with the survey we're doing now. But I'm happy to share that. But it's got the content from all the educational modules. It's got training about the peer mentor role. As Brian mentioned, one thing we did in our program was had our participants set goals that they wanted to reach. And so then the peer navigator would work with them each week to see how they were doing on reaching their goals, whether it was going back to school. If it was a big one like that, we had them break it down into chunks like, okay, maybe this week you see what the application process is like, or one gentleman just wanted to open a can of soup and cook himself a meal. And so, meeting people where they were to help, no judgment about your goal. If your goal was to sit on your porch for 15 minutes a day, that's great. We'll help you do that.
Mhm.
And so the mentors, the navigators worked with our folks just to help see how they did. Did you meet your goal this week? If not, what were the issues? How can I help you problem solve that? Do you need additional resources? Work with them that way as well. And so we had people at the end say they found a provider now that had spinal cord injury expertise that they didn't have before, that they were going to the gym more, that they were getting engaged with their VA office and going to work with our OTC. And one person talked about they just wanted to get a little bit more connected, that they were feeling really isolated before. And I think we know that all too well from what happened during COVID, how people were isolated in their homes. So by having this virtual connection, it helped people feel like that they did have someone that they could talk to and reach out to, which was great.
Susan, if you don't mind, I was going to mention something about just sort of, you mentioned reinventing the wheel and made me think about one of the things that we do with Reeve with our program is we will help provide mentoring for if you're working for a nonprofit, if you're at a nonprofit, a constituent or a member, or at a rehab center or a hospital that maybe doesn't have a lot of mentoring going on because it's small and maybe you're in a rural area. We provide training and then the mentoring support for those facilities. Those are the people who know their people. They know what's going on the ground. So why reinvent the wheel if we can sort of contract, if you will. It's free, by the way, I don't mean contract. But we'll work with existing organizations and just sort of help complement or supplement whatever mentoring they may not be able to provide if they want to provide it. So you can always contact us for something like that as well.
And there are a couple things to think about if you want to do mentoring in an inpatient facility. There tends to be a few more hoops you have to jump through. That I know at our local hospital here, the mentors have to go through the volunteer office to get background checks and all this kind of stuff. And then there's things related to HIPAA where the hospital, because of HIPAA, they can't reach out and say, hey, I've got a new spinal cord injured patient when you come in. So, there are a lot of things you have to work around that maybe you provide the patient information on the peer mentoring program and they could reach out or give permission. So there's just some additional layers of complexity if you're doing an inpatient program, but they're not insurmountable. And I think there is value in getting people connected with a peer while they're in the hospital. So when they go home, they have someone that they can reach out to. Our work has really been community-based through nonprofits. So we've not had to navigate that system with the program that we've developed, but it can be done.
It absolutely can be. And we run into that as well. And we do our best to sort of just work with what they've got, with how they have to do it and stuff. But yeah, absolutely. The shots and all that stuff.
Yep.
So that leads into the question about how can healthcare providers integrate this concept into everyday care. And we're hearing that you can call Bill at the Reeve Foundation, and I'm sure that his contact information will be coming up in the chat box shortly. But you can contact him. You can contact Susan Newman. You can contact Brian and ask them how to do that. But if you're a person that's working in healthcare, either in a facility or you're in a private practice office somewhere, how can you do more activities to get people connected? So we know you can call the Reeve Foundation. We know you can pick up programs and work with people like Dr. Newman, who would be happy to share their information. But how would one approach a patient about a peer mentor program? What would you say to people? How would you find one in your community?
I guess I would start with good old Google search if I didn't know. If I needed to find a resource, and I don't mean to be flip when I say that, but I mean, just thinking if I didn't know. One thing that they do at the rehab hospital here, they have an outpatient spinal cord clinic, and they just have a peer mentor there, hanging out, who is there and available. And if, someone is interested, they can let them know that she's there and she can go visit with them, while she's there. It's interesting. I went to a rehab hospital years ago while I was in the PhD program, And I was shocked to find how resistant the nurses were there to having spinal cord injury self-care information provided by peers, because they were so afraid that the wrong information was going to be given to the patients. And so the nurses wanted to maintain control over all the education that was done with their patients. Now, we know there's a textbook way, that you cath yourself, and then there's the real world way that you cath yourself. And so I think it's finding a balance, between those two things, that people can take care of themselves to stay healthy, but in ways that work for them. So necessity is the mother of invention. And so all sorts of cool gadgets and gizmos have been created by people with spinal cord injury to help them, promote their self-care. So I realized I kind of got off track with what you were asking. But, almost if you just have a peer mentor come to the floor, if you're on a rehab floor 1 day a week and just hang out and be there, I think they're there in a volunteer capacity. And so if there's spinal cord patients on the unit during that point in time, they could be there and maybe just run into them in the hall, and talk to them a little bit. I know a lot of times when people are first injured, they don't want to talk to a peer because they're not ready to see that's, someone like me now. So I know there is some kind of adaptation that has to occur, and readiness to be, work with the mentor after injury. So I probably didn't answer your question very well. So I'll turn it over to Brian or
Well, no,
Bill.
I think that's very important. I'd like to follow up on that with Brian, because I have had that experience where someone was hired to be a peer mentor, but when they became the peer mentor, they told their story to the patients, which is an important exchange of information. That's how we all get started. We tell our story. If it's about spinal cord injury or stroke or whatever, we all have our story. It might not be healthcare related. It might be something else. But the problem was that all the patients were very upset because the peer mentor person hadn't had any education on peer mentoring. And so he turned it into his counseling session where he was having the people who were supposed to, it should be an exchange of information. But Brian, have you had any experience with people who are in the mentoring role that are really not mentoring, but really more seeking? And have you ever dealt with anything like that?
Well, I can describe one of my very first experiences with a peer mentor, and that was when I was in rehab. I was just trying to grasp my injury. I was on a vent at the time, and they had a peer mentor come in who was my level, a C3, C4, but he was in a manual chair and rolled right up to my bed and stood up and told me if you work hard, this is where you could get one day.
Thanks.
And I didn't know how to take it at first, because I thought, okay, that's kind of encouraging in a way, but after thinking about it, it was so discouraging, because I was thinking to myself, I just want to come off the vent right now. I don't want this thing in my throat. And this guy comes in and stands up. So it's hard when, especially for people that are mentors that haven't had a formal training or an education, that they go in it kind of acting like they know everything and they know exactly what the mentee needs to know, but it's not necessarily what they need to know, if that makes any sense. They tend
Well,
to
and
they share
you
too
have to
much
be
information.
Yeah, you have to enter that place where the person is. If like you said, you just wanted to get off the vent. That was your goal. And so that was probably throwing too much information at you all at one time. We all take in information in slow little bites. And Bill, I saw you shaking your head there, so I sure you have a comment about the appropriateness of education of the peer mentors.
Yeah, Brian, kudos to you to be able to get through that and move on with your life, because that is about the worst thing I've ever heard in my whole life, to be very frank with you. I mean, good for you. And that's just
Yeah,
awful.
it was pretty bad.
Yeah, I can't even imagine. Can't even imagine. Yeah, I mean, I think training is really important. And part of our training, when we do our trainings, we have group discussions, we have scenarios so people can play off each other about certain situations relative to how you effectively communicate, nonverbals, those kind of things too, because those are important. But yeah, I mean, and it's hard because you have, in our case with our program, we have mentors across the country, so we don't see them. We don't get to visit or get to know them in a setting. So we have to be trying to do our best to be careful about that, and make them aware of, you've got to meet them where they are. And it's not your time to tell your story, who you are, short of giving them a shared experience so that you can then move on and talk about what they're doing, and stuff. And obviously what that gentleman did was beyond words. I think the other tricky scenario with that also is, how do you talk to someone? How do you share your experience in an empowering a way and not making that person feel like they're not doing enough or not doing anything? We deal with our mentoring. We do a lot of outside mentoring out when they're past rehab and stuff. So they might have been home for 2 or 3 years and they just didn't have the support, didn't have the resources, weren't able to get where they want to get to. And now I'm at this, let's say it's me, I'm at this for 20 years and I've been able to move on. How do I talk to you in a way that's going to empower you and not make you feel like you haven't been doing enough, you're not doing enough, what's wrong with you? And again, that's a balance too. That's another issue that I think we have to be super sensitive to and be aware of and cognizant of going into it. We try and impart that on the folks as well, to kind of think about that as well. How do you talk to someone, empowering them without making them, without belittling them is the wrong word, but making them feel like they haven't done enough yet. When, I had resources available to me, I had support. If you didn't have that, then you're going to be in a totally different boat.
Right.
And so we got to understand that, think about that.
Yep.
And I see there's a question in the chat box about a rehabilitation facility, and most of the larger rehabilitation facilities have peer mentoring programs, or they're in the process of starting them. And this is for people with spinal cord injury, with stroke, that, they cover the whole gamut. There is a person who writes, how do you suggest advocating to strengthen and build a peer mentoring support program?
Give us a call. We'll come talk to him. As I'm sure Brian
I'll
would as
Bill.
well. I'm sure Brian would do the same.
Well,
I'll
I mean,
Bill.
And-
that
and
speaks
I-
to why we do research on this. So you have data to show that peer support helps. I mean,
Right.
when I see numbers that show the people that were in Phoenix report that they've had less issues with pressure injuries, less issues with, bladder complications, less issues with bowel management, and then that they're feeling more confident that they can take care of themselves and their scores are better on the survey that asks, I feel like I can get out in the community when I want, I'm able to move around as I want. I mean, that's data that, we can have relatively good confidence. You're never 100% with research, but it shows some indication of the positive effect of peer support. And so that's why I was talking about evidence-based advocacy. When you have the research evidence, and there is growing evidence. When I first started this work, there wasn't a lot about peer support in the research literature, but now there is more. So that's evidence-based advocacy, saying, look, it works. It helps people, have better quality of life, stay healthier. That I would say that's really an important part of that, as well as calling Bill
And Brian.
and Brian.
Brian.
And we can provide, oh, you go ahead, Brian, go ahead.
No, I just wanted to share something that we've had a neat experience here in South Carolina. The larger rehab hospitals, Rogers C. Peace and Roper St. Francis, two rec therapists from each place have reached out to me and asked if I could help them relaunch their peer mentor program in-house. So they're using, it's been neat, they're using us as a community resource.
Good.
To redevelop their programs in-house, so that way when the patient transitions from the hospital rehab to home, there's a continuity there that we can pair up with one of our mentors that we have through the association.
And that's great that they get connected with the spinal cord injury, South Carolina Spinal Cord Injury Association while they're in rehab. So they know they have that resource when they go home.
And I'll add to what Susan was saying, the evidence-based is huge and great. And listen, at the end of the day, hospitals, rehab centers are going to be looking at numbers too, but we could also add to the emotional part of it, the testimonials, the anecdotal stuff you learn from doing what Brian and I directly do, and Susan certainly directly and indirectly does. And Nurse Linda, obviously too. You bring those pieces into it as well. And I think, you can start to make a case. And as I said, I mean, all kidding aside, we'd be happy to talk to you. We do brown bag seminars with facilities and that kind of stuff, and just, take a 20-minute, kind of, here's what we do, here's how it works. And everything we do is free. So, if you wanted to, we're happy to do that and provide that kind of stuff. But you tie the emotional part to it all. And I think you can make a real solid case.
Yeah, have your success stories,
Yeah.
your spokespeople. One thing I don't want to neglect us talking about is the support for the people who are doing the mentoring, because they need a lot of support too. So when we ran Phoenix, we had weekly meetings with the peer navigators so they could debrief on issues they'd run into during the week, kind of decompress, because we really wanted to come, people non-judgmental, meet them where they were, kind of understand where they were coming from. But usually people who choose to be peer mentors or go-getters, and they're successful. And so often they got frustrated with some of the folks they were working with who just were doing nothing to move forward. And so I'm fairly confident they were good when they were meeting with the mentees, but they needed a place to kind of express their frustrations as well. And so our debriefing sessions were a safe place for us to have like peer support for the peer supporters, that were all serving in this role. How do you deal with this? And we did some additional training about 6 months in, focusing on customer service. How do we want to represent the Spinal Cord Injury Association well, and so the customer service, but also some mentoring tips. How are you an effective mentor? So, I mean, that's important too. So being sure that there's a system to support your mentors as well is really important.
Absolutely. You don't want to forget about the caregivers, or,
Right.
and those people. There is in the question and answer box, there is a message from someone, I'm probably not pronouncing it correctly, but Julia Juarez. If you look for her, notice there, she's from the Craig H. Nelson Foundation, and she has a link there for creating opportunity, independence. So there's the link to the Craig Nelson for the people that are looking for funding and other resources. There was another question up here talking about communication and be sure and getting the word out. Now there's a question here, generally how long after spinal cord injury do people desire a peer support, acknowledging that everyone is different? So when is the best time to start with peer mentoring?
I would say it depends.
Yeah.
It depends. Okay.
Yeah.
It varies. Yeah.
Yeah, I think letting people know that such a thing exists early on is important, because people may not realize that that's available, but then giving them some control over when they're ready. It may not be until they go home and get home and realize, oh crap, I forgot everything they taught me in the rehab hospital. Who was I supposed to call? Then they know they could call Brian at the Spinal Cord Injury Association, because at least they've received that information. That was kind of my initial, I may have said this, spark for the interest in peer support, is that transition home. When you don't have the nurse, with the bell that can come and help you out, who can you call when you go home? If you've got a relationship built with organization like the Spinal Cord Injury Association, or you've at least met a mentor who's willing, to stay in touch when you go home, that's important. But I don't know that there's any best time. It's when it's when the person's ready.
Right. But they have to have that information to know it's out there. So
Right.
getting that information out in the rehab facility is very important.
Right.
And also, if you're a practitioner in a private office somewhere, having you and your staff know what the availability is in your areas is critical, because like you say, you never know when this is going to come up and how it's going to be.
Nurse Linda, can I add something to that?
Absolutely.
One thing, and I completely agree with everything since it's when they're ready, and often when you're first injured, you're not ready necessarily, and you don't even know what questions to ask a lot of the times, I think. But the dimension that we've discovered over the years, one of the things that we do with the Reeve program, is we also provide mentoring for the family member caregiver. So the mom and the dad, the spouse, and stuff like that. And so often the spouse or the mom and dad are very interested in talking to somebody. Now, often they're saying, I want you to get a mentor for my son. Well, it's like, you know what? We don't think your son's ready yet. But what do you need? And we talked to them about self-care. And you touched on this, Nurse Linda, when you said, taking care of the caregivers. And Susan, you were referencing it obviously too, when you're talking about taking care of the mentors. But yeah, I think we often find the parents, the spouses, the friend, the aunt, they want information, they want to help. And maybe be that buffer between the family, let's say, and just, I shouldn't say the buffer. Someone can also give them information because they're so overwhelmed. So often loved ones are looking for mentoring or at least support or information to start with, as they try to unwind this thing, as we all know, which is, when it first happens, it's I can't say exactly what it is on the slide here. So.
Yeah, but I think an important thing when you're talking about asking when is it the right time to start in peer mentoring, I guess the mentee or the patient really needs to understand what peer mentoring is, because Susan, Bill, and I, we've had talks where a lot of times the peer mentor title kind of has a stigma to it in some cases. So you want to explain it more to where they're kind of a partner coming alongside you and helping you get through whatever you need help getting through.
Yep.
Really well put. Yep, absolutely.
Yep.
Yes, it's a very difficult situation to be in. And sometimes it's just difficult to coordinate everything all together. There's so many different elements. There's somebody who's talking about the bowel program, somebody who's talking about the bladder, somebody else is talking skincare, and you have all these tasks that you have to do. And when you first get discharged from the rehab facility, there's nobody reminding you, you need to do this, now it's time for that. And it can be so overwhelming. So getting into that process of understanding what has to be done, how it has to be done, getting that schedule for yourself can really be difficult. And you're getting a lot of different information from a lot of people. So a therapist might be telling you one thing, a nurse might be telling you another thing, and the physician might be telling you something else, a specialist might be giving you different information. So being able to pick through all that information and discern is a process that you really have to learn how to do to know what is the right thing for you. You can't just say, oh, I'm just not going to take that pill because somebody else didn't recommend it.
Right.
But filtering through that, I think that a mentor can help you kind of walk through the process of all this confusion. That's what I see this. They kind of help you settle out some of this confusion of all these things that are going on and how you kind of get yourself organized a bit. They're very helpful in that as well. Now, there is a very interesting question that I just have to ask because I'm waiting to hear the answer. So everybody think about this one. Okay, how can pharma interact with peer mentors for things like clinical trials and other information, getting their information out about different drugs?
That's a great question. Depends on, exactly, is it selling drugs? Is it drug development? Because I saw a great model. I believe it was cystic fibrosis. No, it was a rare disease. It may have been cystic fibrosis. They have a consumer advisory board as part of the pharmaceutical company that helps drive drug development, that the patients could talk about, we really need help with whatever symptom we're having, which I thought was a really novel model. There's an organization called the North American Spinal Cord Injury Consortium, which I know Brian is a member of. They very much advocate for the engagement of people with spinal cord injury in research. And they've got training, a toolkit for people with spinal cord injury of how to be involved in research. They've got resources for researchers who are looking to get people with spinal cord injury engaged in research. As I mentioned, that model is being embraced more and more by funders, where they want to see that true, not just tokenism, but truly engaged in a meaningful way. I mean, it's me, on my team is me and probably 6 people with spinal cord injury. So they really, my team has really helped develop our program and, evaluate what we might do differently. But I think reaching out to the Reeve Foundation, reaching out to organizations that represent the patient population you're interested in working with, and just building a relationship with them. I started volunteering with the Center for Independent Living here, folding newsletters, and went to a barbecue to get to know them before I even mentioned research. So there's a lot of relationship building, because there is a lot of mistrust in the disability community if you're coming at it from the research perspective, that people have been mistreated. There's unethical things that have gone on in the past related to people with disabilities. So there really has to be some effort put in to building trust, and also valuing people's time. I mean, don't expect them to give this stuff away for free. You may need to pay people to be a part of advisory board. So you have to be willing to invest in that. But I think if you're looking particularly for spinal cord injury, I think the North American Spinal Cord Injury Consortium is a great place to start.
I agree with that. They do some fabulous work. And I hate to say it, but we are just 3 minutes away from the top of the hour. I could listen to you, all three of you, all day long. But let's just do a speed round. And what is the one take-home point about mentoring that each of you have, Dr. Susan Newman?
It's essential, but it's got to be, you've got to have trained peer mentors. You've got to have supported mentors for it to work well.
All right, Brian Denny.
Can you go to Bill? I'll finish.
You rolled me under the bus, man. I was trying to figure it out where you were going to go.
Susan spoke too fast. I was
Sorry.
just thinking.
Yeah, I would say try it. And I'll real quickly, I mean, try it, because it's ironic that I run the program, because I was the guy in the hospital saying, I shouldn't talk to you. I got to figure this out on my own. If someone else is going to do it for me, you got to tell me what, I got to do this myself. This was 20 plus years ago now. And I realized I could have shortened my learning curve a lot, even though I did have 6 months in the hospital. I could have shortened my learning curve. I could have made life easier on my parents. I was 24 when I got hurt, and they were freaking out. And I was this guy who has to do it all by himself all the time. And, I survived it, but I would have made life easier for the people around me probably a little bit, and it would have shortened my learning curve. So try it, give it a shot. It really can't hurt, except you get that one guy that Brian talked to, and we're going to get rid of that guy anyway.
Yeah, and I'll piggyback on what Bill said. Yeah, give it a try, because you may know something or experience something that somebody else hasn't. So you can share whatever it is. But just know that if you're in a reputable program,
yeah,
as a mentor, you're going to be trained to know to make it more comfortable for you, as well as the mentee that you're talking with.
Yeah.
Well, I am Brian, I and Bill and Susan, I so definitely agree, is to get together with somebody who has had the education, because you might have a buddy from rehab, and you might have the same level of injury, and you have the same, but you're still different. And your injuries are different. And so sometimes it can be, when it's great to talk to friends, but it's also nice to talk to somebody who has some education and training and knowledge base. And so
And
with
that's
that, I have to,
Oh, sorry.
yes.
I was just gonna we make really clear when we train our navigators what their limits are, not giving medical advice. If someone has a medical question, they don't, you need to ask your doctor about that. So being really clear, so you're not getting dangerous information, I think is really important.
That is really important.
And Susan, something I'll just touch on real quick. You're saying too, talking to your friends and your family is great, but talking to someone who is not a family friend, who can maybe be a little more objective, which I think peer mentoring can provide, is important too, because they're going to look at it a little bit differently, and maybe don't have that same attachment that, my mother would have cut her arm off if I asked her to. So,
Well, and on that note,
Yes,
I'd like to
on
thank
that
all
happy note.
three. I'd like to thank all three of you for participating today. It's been a wonderful discussion. And I've learned a lot, and I'm sure everybody is really excited about getting on board with this. I know that the responses and the question and answers have all been, how do I get involved? How does this happen? And so I would be remiss also if I did not thank the Reeve peer mentors in the Dallas area, because I was at a meeting with them, and oh my gosh, they are all over it. They're really quite a group of people. Yeah, Bill's nodding. They are really quite the group. And so
Get
I
out of their
shout out
way.
to them. Yeah, and to all the peer mentors, thank you for helping support the community, and no matter what the diagnosis is. And to the people behind the scenes that you have not seen that are putting on this webinar, thank you, because they make it all happen. So with that, I have one more thing. This Saturday, if you happen to be in LA, it's the Abilities Expo, and I'll be there on Saturday doing a presentation at 1 o'clock, but I'll be in the Reeve booth for some time before that and some time after that 1 o'clock presentation. So I'll be looking for you. If you're in LA at the Abilities Expo, I'm looking for you. So come say hi. All right. And with that, thank you very much to our guests. It's been a pleasure. And I hope that we can talk again sometime.
Thank you for having me.
Great. Thanks for having me.
Great. Thanks
Enjoy
for having
it.
us. Take care, everyone.